on Hospital Radio Bedford with live music from the studio and all that.
Yes, I do remember.
Unfortunately,
and you usually have a few people.
Unfortunately, I cannot have the instrumentalists in the studio because of the COVID situation.
Yes.
But Amy, my daughter, will be here to sing, and she'll do that to sound check. And then we'll have
okay, go on. Sorry.
Yeah, we'll have other artists join us via Zoom, and they'll do live music as well. And then we're going to have Reverend Margaret McCarthy also, who is going to come to talk to us about the real meaning of Christmas. So I'm really, really looking forward to this show.
Fantastic. I was just going to say my memory of the show is when Amy does her singing, and she's so talented.
Yes.
So it's absolutely beautiful. And yeah, it's quite a good program to have on Christmas Day, Christmas, morning, and to see the Christmas through. So your shows are absolutely brilliant. They definitely motivate and inspire people, especially during those early morning hours when we all need it. And especially
when people are they're tucked up in bed with nice warm drinks and wearing their special Christmas onesies and all. and then we're in the studio here serving you. I just love doing that. It's amazing.
That's amazing.
With my cup of coffee, of course, and my Christmas jumper.
Amazing. So looking forward to listening to that.
Amazing.
Chris, I'll urge everyone to just listen to it. It's really something that will put you in the Christmas spirit.
Yeah, and on top of that, just send in your request. If you want to request a song for your family, for your friends, for your husband, wife, for yourself, for anybody, just send it in. Just go to our website, www.hospitalradiobedford.org.uk, and post it there. Or go to my Facebook page, Opoku, Opare, or you can even send it to Dr. Seshni. She'll send it over to me, and we will make sure that we get your request to you.
Amazing.
Dr. Seshni, people infected with COVID in England can't stop self-isolating after 3 days early if they test negative twice. It has been announced. What does that mean?
Yeah, so the initial isolation period when someone initially tested positive for COVID or had symptoms and had to isolate, it was 14 days. Then it was reduced to 10 days. And today we've got news that they have reviewed it. The government has reviewed it. And the guidance now, which is very positive, is that people need to isolate once they've tested negative with lateral flow tests on day 6 and 7. They need not continue to self-isolate. And I think the reason why they're doing this, according to what the media is, the information we're getting, is that because people obviously want to spend time with their families. So this is really positive news.
It is positive. It is positive. And Sajid Javid is the one who announced it, isn't it?
Yes.
And he's saying that the change was based on the latest guidance from health experts. Now let's come to Christmas, okay? And I'm smiling, because the Prime Minister is saying that no new COVID restrictions will be brought in for England before Christmas. The Prime Minister has said. So Bojo said ministers can't rule out any further measures after the 25th of December, with Omicron spreading at a speed never seen before. So there's a possibility that we're going to have stricter measures after Christmas. But before Christmas and on Christmas Day, we're free to do what we want to do, isn't it?
Exactly. So yes, this is like the show today is like a dream come true, because everything seems to be quite positive. Amidst the Omicron crisis and increasing numbers in the UK, things are looking very positive. So that is fantastic news announced by Boris Johnson, that obviously no further restrictions will come into place. But I don't want to be the bearer of, bad predictions. I do feel that because we're not going to have any restrictions, It does seem quite positive, and people are going to spend time with their families, which obviously last year we could not. All our plans had to cancel, including ours. People were in different social bubbles, different levels, and what happened is the country had to stay in those levels and bubbles, and people were not allowed to even meet for Christmas. So it affected a lot of people. So obviously the news now that there's no further restrictions is fantastic, and everyone is quite happy and excited, which rightly so. And I don't want to impede on that, or dampen anyone's spirit, but I think we do need to bear in mind that there's a possibility, if numbers continue to surge after Christmas, after all the Christmas parties, and then looking at New Year's very soon after Christmas, there's a possibility that we might have some other restrictions come into effect. But I think the government is doing everything in accordance to what it feels is necessary at this moment in time.
Mm-hmm. I think you. I think I can say positively that you're not a bearer of bad restrictions. It is kind of obvious, isn't it, that with no restrictions at all for Christmas, because I'm just reading this. There will be no restrictions on how many people can get together for Christmas in England. And that's what the Prime Minister has confirmed. So, for example, if my family decide that we're going to meet, I'm not talking about my core family, but my family, if you know what I mean.
Yeah.
We could easily have about 60 people in my garden. You know what I mean? But that's not going to happen. But what I'm saying is, but if all of us decide that we're going to get together in one person's house for Christmas, then the danger is there. There's a possibility of after Christmas, there's probably going to be big numbers of what you call infections, isn't there?
Yes. So, yes, I think in terms of what's going on, I think, to be honest, as I said, the government is doing everything in accordance to the policies and WHO guidance, and obviously what's happening in other countries, and they'll be looking at the numbers and figures in the UK as well and making those decisions and looking at what has happened in the past. So SAGE, together with Boris Johnson, everyone in Downing Street, and all the health ministers and Mayor of London and Sajid Javid, everyone, all is going to be looking at what's going on. So we know that obviously it's still early days, but in terms of what's going on, we are obviously predicting that there is possible that some restrictions may come into effect. But as it stands, I think what they're hoping as well, Opoku, is about 2 years down the line, a year and a half, 2 years down the line, with the COVID pandemics and different waves of the infection, I think what they're hoping is that people are really sensible and responsible, and people are adhering to the guidance, which at the moment is wearing a face mask is compulsory. So whether you are going to on if you go on the underground or the trains, wearing a mask is compulsory, and most people are adhering to that guidance. If you are in a restaurant or going to pubs and other places, you do need to wear a mask. Even in cinemas, they've announced that you have to wear a mask and maintain social distance. So all these places, except when you are eating or drinking, your mask will be off, but otherwise you will need to maintain that social distance and wear a mask. People are using hand sanitizers, people are getting vaccinated, and also when people are presenting with any symptoms, they are isolating themselves. So I think we have a lot of information, a lot of education, a lot of awareness around COVID-19. So people are obviously feeling more comfortable that they are obviously preparing and prepared for if any of the numbers go up. So I think what the government is hoping, that the numbers may not increase as much as we think it might, because with all these measures in place, preventative measures, people are still able to manage the pandemic. But obviously, if the numbers do go up, then we will be looking at other restrictions. But the fact that they've reduced the isolation period, they're not having any restrictions. Christmas is going to go ahead. New Year celebration will go ahead. It's all quite positive news and news in the right direction. And also bearing in mind they're having mass vaccination rollouts, and in terms of people still getting dose 1 and 2 and then the boosters. So there's a huge campaign and drive to get people vaccinated as soon as possible.
Yeah, we'll talk about vaccination and the boosters before you go away. But now, all these things we've been talking about is sort of just for England, isn't it?
Yeah.
Because there are different rules in different parts of the country.
Yes.
So, for example, I'm just reading this as a plan for COVID rules after Christmas in Wales will be announced by First Minister Mark Drakeford on Wednesday. Well, we don't know if Boris Johnson is going to announce anything for after Christmas in England. I'm sure he will. But for Wales, they're saying that his government expects several thousand Omicron cases by the 26th of December. And says more restrictions are needed to prevent the NHS from being overwhelmed. Measures could include table service, social distancing, and a rule of 6 in pubs and restaurants. Limits on indoor mixing, including a return to household bubbles, could also be on the cards. But it is not clear whether households will simply be advised to limit socializing or told to go through new laws. Omicron, so at least we know we have a glimpse of what might happen in Wales after Christmas, but we don't know about England, do we?
Yes, exactly. So
we don't know what's going to happen.
I think we are going to see similar rules if Wales is going to do something like the bubbles in place and also the rule of 6. So it's possible that we will continue, that Boris Johnson might decide together with Sage and the rest of the team that we might need to do certain restrictions. So we'll see what happens. But as we spoke a few weeks ago, I did feel that we should have brought the bubbles back into place, because I think having the bubbles would have been a way to ensure safety, and especially now where there's a lot of Christmas parties, there's lots going on, people socializing, people shopping, getting ready for Christmas, lots of partying and, other celebrations going on. There's a huge risk of obviously people spreading, and obviously if they do have Omicron or any other COVID-19, that they will be spreading it. But Omicron still seems to be a huge concern in the UK. Talking about other countries, we know that other countries, I think Netherlands is it, where they've announced earlier in the week that they are going into a 1-month lockdown. So there's other countries which are taking drastic measures, which obviously we need to consider. Why are they doing that? And is it something that we need to do in the UK?
All right. Okay. Now, the other country in the United Kingdom that I wanted to talk about is Scotland. So they're saying that changes to the self-isolation rules in Scotland are being considered in a bid to ease pressure on public services, the Deputy First Minister has said. Because, believe it or not, but Scotland have stricter rules than we have in England and Wales. They're saying that fully vaccinated people who have coronavirus currently have to self-isolate for 10 days. Okay. But in England, that has been cut to a week now. Okay. But in Scotland, it's for 10 days. And it's been cut to a week for people who get negative lateral flow results on day 6 and day 7. So that's dependent. And so with the England rules, it's dependent on your test results on day 6 and day 7. Okay. Now, Joe Sweeney of Scotland said such a change could help tackle the immediate threat of public sector staff absences. There's a lot of absences at work because of what's going on with the Omicron.
I totally agree. Even there's a lot of absences at lots of workplaces. And I think it's because people are being exposed. Lots of family members are testing positive, and then people are having to isolate. People are also quite stressed and overwhelmed. It is, to think about it in terms of mental health, what we've gone through as a psychiatrist. it is a lot for people to actually take on board, in terms of processing, and also having that resilience to continue. We've gone through so much in terms of lockdown, in terms of COVID, in terms of having to get vaccinations, and also people, just having these restrictions in our lives and having to live a life that we never envisaged for ourselves. I mean, never any of us could have imagined that we are living a life where we have to social distance, we have to wear masks, we have to keep isolated, we have to use hand sanitizers. So it's a lot of pressure, a lot of stress. So it's normal, I think, that people are actually feeling the effects of it. But what I do want to say is that it is hope. There is hope that things are going to get better and that we're at a better place than where we started off. We've had the vaccinations, so we're definitely better off than not having the vaccinations. And also, we've got the boosters and we've got good treatments available, and healthcare professionals are more prepared, and also the NHS is more prepared. So, the government is also more prepared and taking action. So I think there's a lot of stress, and as a result also of the increasing numbers and spread, people are going absent from work.
And still talking about Scotland, COVID rules are being tightened again in Scotland, they're saying, as cases of the Omicron variant continue to spread. Now, Hogmanay, I don't know if I'm pronouncing it correctly.
Yes, it is. Yeah,
it's
Hogmanay.
Did I pronounce it correctly?
I think you did. Well, I think you did. Hogmanay.
Okay, so Hogmanay events have been cancelled. They've been cancelled as new limits on large events come into effect on the 26th of December. They're saying that Christmas celebrations can take place as planned, although people are being advised to limit socializing to 3 households before the festivities and take a lateral flow test before mixing with others. Shops and hospitality venues are also being told to take steps to tackle the spread of the virus. So that's what's going on in Scotland at the moment.
Yes, Scotland, Wales, and even Ireland are taking in other measures. So I'm not surprised that they've actually cancelled that, because I was, we usually for New Year's we usually end up going to London to see the fireworks display. We've done that most years, or we were planning at one year at least to go to for the Hogmanay in Edinburgh, but. I'm not surprised that they've actually cancelled it. I'm not sure what London fireworks display will be like, and whether it will be like what they did last year, where, most people, I don't think a lot of people went into London. It was on TV, it was live streamed, which was brilliant. We all look forward to the New Year's Eve celebration and New Year's celebration all over the world. So London was spectacular. Hogmanay is absolutely amazing to attend. So, but I'm not surprised that they've actually cancelled it. And then, to be honest, well done to Scotland for doing that, because it's obviously it is, because in terms of people getting together, celebrating, being in close proximity, drinking, there's a lot to think about, and it's putting people's lives at risk. At the end of the day, we need to realize we need to save lives. We need to ensure the safety for ourselves, our loved ones, and our community and country at large. So whatever measures are in place, we all need to adhere to it. We need to listen. We need to follow the government guidance and the WHO guidance, the World Health Organization, and we need to just protect ourselves as much as possible, and our families and friends.
Before we do the numbers, let's talk a bit about vaccination. I know you've had your booster, haven't you?
I did last week Tuesday, so that went well, thankfully. Yeah,
I was supposed to have mine yesterday, but I had to postpone it because there was some other things to do around the same time that I got booked, and so I'm going to do it tomorrow. But there's this thing going around. I haven't seen it firsthand. People are saying that the booster puts you down, you feel weak, you're sick, and this and that. And I know I've heard of people cancelling shifts, not going into work because they've just had the boosters or the booster. Tell us from your personal experience, how did it go? And how did you feel after that?
Yeah, that's very accurate information that you've just said and shared from other people's experiences. Just to say, the booster vaccination, at work we've been fortunate because there's a huge drive to vaccinate as many health workers as possible. So they've been very supportive. We've had like numerous clinics. So it's been really easy to just go and get the vaccination. Even if you didn't have an appointment, you can arrange it quite easily. So the whole process was really simple and easy. On the day that I received the vaccination, I didn't have any, to be honest. With vaccinations, as we know, in boosters, we are going to experience some side effects and effects because obviously we're obviously taking the vaccination. So the normal side effects, 1 in 5 people might experience, is tiredness, lethargy, pain in the arm, which has been a very common symptom. So lots of people have reported pain in their arm. People have reported fever and muscle aches and pains and some other flu-like symptoms. Fortunately for me, I did not have any of those symptoms. I still worked. I took it the Tuesday and I was still working in that week, and just hoping that obviously I didn't get the other symptoms. But I do know a lot of people that I knew that got the boosters did complain of severe tiredness, lethargy, weakness. They were in bed. They took off from work. A lot of people took off from work. And also had fever, muscle aches, all the symptoms I've described. But that's what I'm saying. So not everyone will get it. It's 1 in 5 people will get it, but they for some reason, some people are getting it more than others. But it's like when you took the first and the second vaccine, some people got symptoms. Some people got side effects and others didn't. But just to reassure, to be honest,
I didn't get anything at all. No, nothing, absolutely nothing, except for slight thing in the arm, just that tiny thing. The first time, the second time, same. And so I'm kind of encouraged to go and get the booster. And now you're telling me you didn't get any side effects.
No.
That even makes me want to do it now.
No, to be honest, I didn't.
I'm encouraged.
Yeah, no, I didn't. I mean, I'd tell you if I was, but I think maybe it's just my practices have kept me quite healthy and safe. And yeah, my arm actually, I knew that I had an injection, like a vaccination there, but it wasn't so painful to the extent that everyone was describing. I just knew that I had it. And I went to work. I was traveling every day, going to work full days, being in meetings and being in hospital and seeing patients. So I was fine, but I know a lot of people have experienced it. But I think if you haven't had symptoms before or any side effects, you should go and have it as soon as possible. There's mass vaccination centers. There's centers all over Opoku, so I think you can even just go.
Everywhere. Just the pharmacies around my village here, 2 or 3 of them, they're doing it. So you can just walk in and I think that's fantastic. Anyway, we haven't got too much time, but before we do the numbers, I like to, encourage. And of course, there's a disclaimer here. You don't have to do it if you don't want to. But I like to encourage you to go and get your jabs and get your booster as well. And I was reading this article last night actually. I can't remember who, but there's this doctor who said something that I thought made a lot of sense. Say that people are saying, well, I don't even know what's in the vaccine, and I don't want them pumping stuff in my body and all that. And then he said that, but if you don't get the vaccine, and if you get COVID and you go to hospital, they will pump stuff in you. They don't put a cocktail of drugs in you. Yeah. You don't know what those drugs are, do you? No. And they all have side effects as well. So you might as well just go get your jabs, and but at the same time, this is the disclaimer. It's entirely up to you. You don't have to take my word for it. Anyway, should we do the numbers, Dr. Seshni, and then we...
Yes, definitely. So in terms of the numbers, it's so great to be on the show and be able to, do the numbers.
Are you back? Are you coming back tomorrow?
Yes, back tomorrow and Friday.
Are you joining me?
Show.
Yes.
So full swing for the week, and next week, Monday, if you're doing a show. So just let me know. Monday and Tuesday.
Fantastic.
Yeah, so I'm ready when you are. So in terms of the coronavirus figures, I do have the figures. So I hope it's the accurate numbers. I'm just going to go into recent. Yeah, so I think it should be accurate. So in terms of the cases, as of today, is it the 22nd of December, and it's just 3 more days. Is it 3 more days?
Can you believe it?
I cannot believe it.
Can you believe it?
I cannot. I'm so excited for Christmas. I feel like a child. Just, I just love the Christmas and the festive period. Even though a lot of people are finding things difficult, we can talk about mental health and how to keep yourself safe over the Christmas period, and just to boost your spirit. We'll talk, maybe tomorrow we can have some time to talk about that, especially during. Yeah. But so just cheer some of this, cheer everyone up, and spread the Christmas spirit. So in terms of the coronavirus figures, the cases worldwide, as of today, the 22nd of December 2021, it's 276,681,254. The total number of deaths are 5,388,038 deaths, and every life matters. Total recovered is 248,220,113. So quite a large number that have recovered. So top 5 countries. We have USA 52 million with 52,253,848 positive cases and 830,990 deaths. Sorry, India 34,758,481 with 478,325 deaths.
Get a drink of water.
I'm getting
Get a drink of water, Dr. Seshni. Just take a sip. Just take a sip. Don't worry about it.
That doesn't usually happen. I think it was just something that got into my throat.
No, it doesn't. It doesn't. But don't worry. We're humans. These things happen all the time.
Oh, thanks to Ari, and I've just got my glass of water. Thank you.
Yeah, go on. Have a drink.
Thank you so much. Yeah. So India number. Should we start again? So USA number 1 with 52,253,848 positive cases, total deaths 830,990. India number 2 with 34,758,481 positive cases with 478,325 deaths. Brazil number 3 with 22,219,477 positive cases with 617,991 deaths. UK number 4 with 11,542,143 positive cases with 147,433. So that's quite significant for England, isn't it? Number 4 in the world.
It is.
Yeah. They've actually moved spaces with Russia, isn't it? Or have they?
Yeah.
So Russia's number 5.
But the UK has been on number 4 for a while now.
Yeah, but they figures in terms of the number of deaths, Russia is more, but in terms of the figures of infection, UK is more.
Yeah. UK is more, yeah.
Yeah, Russia's number 5 with 10,292,983 positive cases with 300,269 deaths. And we've got other countries, South Africa, number 18 in the world, with 3,332,008 positive cases. So that's also rising, I think, and 90,488 deaths. So still quite significant, I would say, in terms of Russia and UK, and also in terms of South Africa. And then in terms of Ghana's done really, really well. So they are 107 in the world with 133,046 positive cases with 1,263 deaths. And I'll just do the 24-hour figure for UK, which is quite significant. I was looking at the figures. So as I said, it was 11,542,143 cases in the UK. Total deaths 147,433. We have the last 24-hour figures, which are significant. It's really quite concerning, to be honest.
It's concerning. 90,000. Gee.
90,629 new cases and 172 new deaths.
172 deaths.
And one of the paper's headlines said that they've given these figures, and they said this is now the total number that we're seeing is more so it's been in a 4-week period that they've been looking at it, because you must know Omicron started around the 23rd of November. So we're coming up to 4 weeks, Opoku. So in 4 weeks' time, we've gone to 90,629 cases and 172 deaths. So it's quite significant. The day before was 91,207 with 41 new deaths. The day before, 82,347 new cases and 44 new deaths. And the day before that, over the weekend, the 18th of December, was 89,571 with 125 new deaths. So we are looking at over 100, 150 deaths and over 90,000 cases. So my prediction is it's gonna go higher than that. We're gonna have, I'm sure I've seen news about what's Sajid Javid saying, or someone's predictions that it's gonna be up to 500,000 a day in terms of injections. So I think we do need to be careful, and we need to sort of really ensure that we are adhering to the guidance. We were in London yesterday, myself and Ferdinand, and we thought twice about everything we were doing. We just went for what we were supposed to do, and we came out, because in the tubes, the undergrounds, it's packed. There's a lot of people. Wherever you go, there's a lot of people. So you really need to stay safe, because you don't know where you can go and where you can actually pick it up. And even to eat out.
I don't think I'm gonna go on the tube anytime soon. No.
Yes, and I think even I think what each person needs to do is just reassess what you need to do, what plans you need to make. Like you were saying, you're not going to go. Even for us to go and have something to eat, we rather came back to Milton Keynes and had something. We didn't go out in London. As tempting and exciting as it is to be in London and just to go out for a meal, we just didn't do it, because there is a huge risk. So I think we all just need to be sensible.
Yeah, thank you very much, Dr. Seshni. We're just running out of time now. We only got 10 more minutes to go. And it's so lovely to have you on the show. And tomorrow, I'm really looking forward to having you again on the show. So we'll talk more on the. But tomorrow, as you suggested, I think we should. Let's talk about the effect, the mental health effect, or the effect that, COVID-19 is having on mental health. Especially around these times.
I couldn't have said it better. I'm looking forward to it, and just discussing about how we can help people over the festive period, and how people can take care of themselves in terms of mental health over the Christmas period. So thank you so much. Lots of love to everyone. Stay safe, and let's spread the love and not the virus. Love to everyone in your side. Opoku, thank you. Have a fantastic day.